we are delighted to have Dr. Samir Malkani today, and we are going to talk about diabetes. Dr. Malkani, thank you very much for coming to our studio.
Thank you, Upendra. Thanks for having me.
Welcome. And we are very, very happy to talk to you about diabetes today.
It's a pleasure, yeah.
So let us start with, in the Indian and South Asian community, we see that diabetes is very, very prevalent among virtually all age group. So what is the reason why it is so prevalent in the South Asian population?
We're not sure about the reason why it's so prevalent, but the fact that it is very prevalent. And about 20 years ago, it wasn't as prevalent in the South Asians. And in fact, we were seeing it more in the South Asians who were outside India. The people in India, prevalence of diabetes was low. It was about 4 or 5% at the most of the population. Today, 20 years later, it has jumped enormously. In India, the prevalence rates we're not very good about calculating prevalence rates, but depending on where you look at, it's between 10 and some places up to 20% in some cities, like in South India. There's a big study going on, Up to 18% of the people have diabetes.
How is it overseas?
Overseas, it's always been very high. When I left India in 1991 and I went to the UK, and the only thing I was hearing in the UK is how the South Asians who lived in Birmingham and in the big cities in the United Kingdom, they have a very high prevalence of diabetes. Actually, that's what got me interested in diabetes. And they were studying these people to see why they had such a high prevalence of diabetes. And now in the US, we have more and more South Asians, and we're finding that the prevalence is very high even over here.
So when we say South Asians, we mean, of course, Pakistan, Bangladesh, India. It's the same demographics, right?
And Sri Lanka.
And Sri Lanka.
We are the same ethnicity, basically.
Okay, perfect. Now, what are some of the symptoms of diabetes?
So the early symptoms of diabetes are most of the times people don't have any symptoms.
Okay.
And that's why diabetes is so dangerous, because the onset is so slow. So most of the times people don't have any symptoms. They don't know that they're getting diabetes. Sometimes when the blood sugar goes up very quickly, you do get symptoms. You get blurring of your vision. You feel very thirsty. You urinate a lot, and you start losing weight. But most of the times it's silent. It's a silent disease, just like blood pressure, high cholesterol. You only find out when you go to the doctor to get checked.
Sure. So what should we do? Like, for example, is there any particular age where one should be really careful and think about testing?
Yeah. So usually it happens as you get older. Typically in the Caucasian people, diabetes happens in the 50s and 60s. In South Asians, it happens 20 years earlier. So we get diabetes in our 30s and 40s. So, after the age of 35, I think it's a good idea to just have a simple blood sugar test when you go to your doctor for your annual physical. And most of the time, the doctors will do it because they know that the incidence of diabetes is high in our population. So they would do a blood sugar test. And if the random blood sugar is over 200, you can just make a diagnosis of diabetes. But if it's not, there's another test called the hemoglobin A1C test, which we do, and there's a cutoff. If you're over 6.5, then you have a diagnosis of diabetes.
So what are the precautions one should take? Like, say if I'm diagnosed with diabetes, what is my next step after that?
Well, after you're diagnosed with diabetes, so there are two kinds of precautions. I thought we were going to talk about what precautions one should take to prevent yourself from getting diabetes.
Let's start with that. I think that's a better approach.
So the first step to take is if you have a strong family history, you have to be extra careful because people with diabetes do have a strong family history. Now I'm going to go back to your first question. You asked me, why do South Asians have a high prevalence of diabetes?
Okay.
So what we found is that people from South Asia, they're very insulin resistant. The insulin is a hormone in our body that controls our blood sugar. And in us, the insulin doesn't work as well as in other people. So we have to have higher insulin levels to control our blood sugar. So we're very insulin resistant. Normally, you get insulin resistant as you get fat. As you get obese, you get insulin resistant. But in South Asians, we get insulin resistance even when we are lean. So when I worked in India, one of my colleagues, his name is Dr. Yajnik, he did a lot of research on this to find out why South Asians are so insulin resistant. And we are actually fat, even though we might look thin, because we have a fat in our belly.
Okay.
So he did an interesting experiment with a colleague of his who was from the UK, and they're both the same age, same height, same weight, so same body mass index. And they both did a CAT scan of their stomach. And they found that this Dr. Yajnik, who's otherwise a very thin-looking individual, had a lot of fat in his stomach. So we tend to store a lot of fat in our stomach, and that makes us very insulin resistant. So the insulin can't work, and our blood sugar goes up very high.
Sure, sure.
And so one of the theories as to why we South Asians are insulin resistant is due to what we call fetal programming. We are programmed at birth. You know, the highest incidence of diabetes in India is seen in those people who were born to mothers who had some malnourishment during pregnancy. And then when they grow up, these people grow up and they get overweight. Then they have the highest incidence of
And
diabetes.
which could be very common in India, malnourishment, among the
Actually,
especially good.
it's getting even more common. You know, in India, the disparity is increasing.
Increasing.
So what's happening is in the villages and in the small towns and in some slums, people are malnourished. And due to the economic boom, the children that are born, they do very well. And then they get a little overweight, and then they get diabetes.
Sure.
That was an interesting experiment of nature. It actually happened in Netherlands in 1944 at the end of the World War. And it's called the Dutch famine. There was a bad famine. It was a man-made famine because the Germans had prevented the food from getting into Netherlands at the end of the World War. In 1944, they were rationing out food. And the women who were pregnant at that time, the babies that they had, they, later on when they grew up, they had a very high incidence of diabetes. And so they found that the women, when they were malnourished in pregnancy, their offspring or their children have a very high incidence of diabetes. And we found the same thing in India.
Excellent.
So there's some kind of fetal programming that takes place. So if the fetus or the unborn child, if they're deprived of food, if the mother's deprived
So
of
that's why
food,
the nutrition of the pregnant mom is very, very important.
Very,
It's,
very
very
important.
to have that.
And then when that happens, when the fetus gets programmed to get diabetes, naturally there's no genetic change, but there's what we call an epigenetic change. The genes are manifested differently when the person grows up. And that epigenetic change is intergenerational. In other words, you can pass on that same problem to your child. So if a fetus gets programmed or an unborn child gets programmed in the womb and grows up to get diabetes, then this diabetes is passed on to the future generations.
Sure.
And to turn off the switch, you have to improve the nutrition of the population for a few generations, and then the switch is turned off.
Right.
So I think that's one of the explanations why South Asians have so much diabetes. We're so prone to getting diabetes.
Sure. Now let us talk about there are two types of diabetes, type 1 and type 2.
Yeah.
And what is the difference between these two? And
So most of what we are talking about, Upendra, is type 2 diabetes. So type 2 diabetes is the common form of diabetes that we see. About 90% of the people have type 2 diabetes. Type 1 diabetes is a form of diabetes seen due to complete destruction of the cells that produce insulin in the body. And that destruction can generally appear at any age, but generally appears at a younger age, in children. And that destruction, in most cases, is due to an autoimmune phenomenon. It's an autoimmune disease, just like rheumatoid arthritis and your own immune system is attacking your insulin-producing beta cells in the pancreas. So that's an autoimmune disease. It's not that common as type 2 diabetes is. Type 2 diabetes is what we see. It's a disease of getting older. As I said, in South Asians, it occurs at a relatively younger age. And now we are seeing in children who are getting very overweight.
what about the South Asian children?
South Asian children are more prone to getting type 2 diabetes as if they're overweight and they're sedentary. They don't get much physical activity. They come home, they play video games, they eat big snacks. Then they start getting diabetes in their teenage years. And it's hard to manage. They have a whole life that they have to live with diabetes.
So earlier we were talking about that before we go, that what precautions we take after we are diagnosed with diabetes, but you raise a very important point, how to prevent it.
Yes.
So if I want to prevent diabetes and I know that my family has a diabetes history, what are the 3 or 4 things I should do?
The most important thing to do is to exercise every day.
Okay. How much exercise? Is there any time?
At least 30 minutes of exercise.
Okay.
And it has to be every day, at the minimum 5 times a week. And people find exercise very boring, honestly, I tell you. Even the athletes who you see, they exercise all the time. If you ask them, do you enjoy exercising? They'll tell you, no, I really don't enjoy exercising. I do it because I have to do it. It's my profession. So it's good to try and make it interesting. Make your exercise space interesting. Put on a TV there, some music. Have a few different pieces of exercise equipment so that you can vary your exercise routine so that you're not stuck on a treadmill for 30 minutes.
Sure.
So you do that every day, and good to get it done in the morning. So exercise every day, that's very important. And then eat a healthy diet.
So a healthy diet should include what?
It should include whole grains. You don't want to have a lot of processed foods in your diet. We're getting a lot of processed foods in our diet every day. And sometimes we don't even realize it's processed foods.
Sure.
You know, even bread is a processed food.
Sure.
They have a lot of things we don't understand how they affect our metabolism. A lot of preservatives, chemicals. A lot of the food is grown in fields, and there's pesticides, and they all come into our system, and we really don't understand the effects of all these things on our metabolism.
So exercise, food, what is anything else we should
That's it, exercise, food, and healthy lifestyle. Stress also causes your blood sugars and blood pressure to go up. So as much as you can avoid stress, it's hard to avoid it, right?
Yeah, I mean, that's my next question was going to be how you can avoid stress.
Well, everybody has different techniques of avoiding stress. And if you do feel stressed, there are stress reduction programs which employ mind relaxation techniques, yoga. But if you feel stressed, I think it's good to take part in a stress relaxation program and learn stress relaxation techniques. Not everybody feels stress. Some people can handle stress better than others.
Now, if I have, or any one of our the viewers, they think that they have tendency or family history of diabetes, should they be afraid of this diabetes?
Well,
how scary is diabetes?
Well, it's scary only if you don't take care of it. In general, this is epidemiological studies. By an epidemiological study, I mean if you study hundreds of people with diabetes in the population, we find that diabetes cuts your lifespan by an average of 10 to 15 years because of the complications. So you have to be afraid of it at some level. But we also know if you take good care of it, you can live a long, healthy, full life with no problems. So I think rather than being afraid of it, you should be proactive and take care of it.
So when you said that, it on average takes about 10 to 15 years of your life, when that starts actually?
It starts at the day even before you're diagnosed, because even prior to the diagnosis, because we have a cutoff for diagnosis, a blood sugar cutoff. But the blood sugar grows up gradually. The cutoff, in a sense, is artificial. We just say this: you have diabetes if your random blood sugar is over 200. But the blood sugar is a continuum, and it slowly goes up till it reaches 200, and then you're diagnosed with diabetes. Even in the process of going up, you are getting some adverse effects of the high blood sugar.
So now, what are some of the body parts which are first affected by the diabetes?
Almost every body part is affected by the diabetes, but the complications that most people dread the most are complications involving the eyes, because diabetes is today the commonest cause of adult onset blindness in the Western world. And it affects the eyes, sometimes irreversibly. You get bleeding in the eyes and you can lose your vision. But again, if you take care of your blood sugar and you see an eye doctor regularly, most of the problems can be taken care of. The other problem it causes is heart problems, and more so in South Asian people. People with diabetes have a risk of heart attacks that is about 2 to 3-fold more than the general population. So when you're diagnosed with diabetes, you also need to take care of other risk factors that involve heart attacks, and that is your cholesterol and blood pressure. So once you're diagnosed with diabetes, our goals for lowering cholesterol and blood pressure become even more stringent. So we work very hard at lowering blood pressure, cholesterol, and blood sugar.
What about kidney that I hear a lot about?
Absolutely. Diabetes is also the commonest cause of kidney failure and dialysis. So it can affect the kidneys over the long term. Again, if you have a regular urine test, you can tell if it is affecting your kidneys. And there are medications that will slow down the effect of diabetes on the kidneys. So you can take those medications. They're called ACE inhibitors. It's a class of drugs that lowers blood pressure and protects the kidneys. So at the earliest sign that you show any protein in the urine, you can start on the medication, and it will reduce the risk of getting kidney failure. It also affects the nerves. People with diabetes will say they get terrible nerve pain, pain in their feet, more at night. And again, there are medications to ameliorate the pain or relieve the pain. But if you take care of your blood sugar, none of these complications should happen if you
take care of it.
Take care of the problem.
So, if as a doctor who treats diabetes, if I ask you that in the next 5, 10, 15 years, do you foresee a magic pill that you take a day and everything is gone as far as diabetes is concerned?
For type 1 diabetes, we might have something because we know exactly what happens. It's an autoimmune process. So we might get something to slow down that autoimmune process or cut down that autoimmune process so that the beta cells or the pancreas cells do not get destroyed. In type 2 diabetes, the disease is so complex. It happens, as I said, there's some genetic or epigenetic programming happening. You are getting insulin resistant. So I'm not sure if we can get one pill that will cure everything unless we make some advances in what the epigenetic changes are. But science advances at a rapid pace, and my prediction could be completely wrong.
So how do you look like the progress we have made in the last 15, 20 years in terms of fighting diabetes?
That's a great question, because we've made a lot of progress, and progress, in any field is based on the demand for the progress, and the demand is great because diabetes is so common.
Sure.
And besides the South Asian population, it's increased in every population exponentially in the past 20 years. And our simplistic explanation is because people are growing heavier.
Sure.
So the pharmaceutical industry has responded to that disease, and they've looked for various ways to treat it. And they try to understand what causes the blood sugars to go up so that the newer drugs that help insulin resistance, that help production of insulin, that help release of blood sugar through the kidneys. So we have a lot of new drugs. In the past 20 years, 20 years ago, to treat type 2 diabetes, we just had 3 groups of drugs. We had insulin, we had a group of drugs called sulfonylureas, and we had a drug called metformin. This is 20 years ago. We just had these 3 drugs. And now we have 11 or 12 different kinds of drugs. And within each kind or each class of drugs, we have 2 or 3 drugs. So we have about 30 or 40 different drugs. So there's a drug to fit every profile.
Now, is there any difference in diabetes in men versus women, or men have more, women have less? Is there any study like that?
Women tend to have a little more, but I don't think the difference is that great. The implications of diabetes is more in women, mainly because women are the childbearing individuals, and when they get diabetes and if they get pregnant, then the child also gets affected.
Makes sense.
So gestational diabetes is a very important health problem, We find that women who get diabetes and are pregnant, their offspring, their children, they tend to have diabetes more often. They have problems early in course of their lives. So which is why diabetes in women, I think, is a bigger health problem, but it affects both genders.
Now, if you take say top 10 diseases today faced by the world, in terms of 10 being the worst, where you will put diabetes?
I think diabetes is one of the top 10.
Okay.
Now, everybody's priority is going to be different, depending on your individual situation, depending on where you live. So if you live in a country like India, there are so many basic health problems. We just started to eradicate polio. We have so many infectious diseases related to hygiene and sanitation. So I think in a country like India, maybe diabetes will still be in the top 10, but maybe lower down in that top 10 list. In a country like America, I think diabetes is very much in the first 2 diseases in the top 10. Of course, one of the main causes of mortality, everybody wants to look for a cure, is cancer. And everybody's going to debate what the top 10
So how
are.
do you look at cancer versus diabetes?
Well, cancer is very devastating.
Sure.
But
what you were saying about diabetes, that how it affects you and it takes you 15
It does,
years.
but if you take care of your diabetes, I think it's very treatable.
Okay, so that's the
You can control it.
Sure.
You can control all the complications. For cancer, sometimes we don't have any treatments.
Okay.
For diabetes, I think, and I have to tell you, the best treatment for diabetes, after all the 20 or 30 drugs that we have today, is still diet and exercise. Diet, if you follow a good diet and exercise, you can lower your blood sugars much better than even taking a huge dose of insulin.
Now, can you say, for example, even if you are taking, say you are started to take all these pills and tablets to control your diabetes, and you determine that, okay, you know what, I want to get off the pills. Can you get off the pills after start taking it? Or
Absolutely. Not? I have many people who have gotten off the pills simply by losing about 20 or 30 pounds, which is, about 10, 12 kgs. You lose that much weight, you can get off 2 or 3 pills for your diabetes and control your diabetes. So weight loss by diet and exercise can help a lot. Recently, we've developed surgeries to help people lose weight. They're called bariatric surgery procedures. And the procedures that are formed by laparoscope. So you don't have to have a big operation and a big cut. And these operations can make a person lose up to 100 pounds in weight and get down to their ideal body weight. After having these procedures, 70% of people with diabetes will have a remission of the diabetes. In other words, the diabetes will go away after having the procedure.
So somehow it may be my misread. Somehow many years ago I had read somewhere that that once you go on the pills you cannot get off. So
that's not true.
That's not true. Okay.
Yeah.
Now, one last thing for you is if you have to give 2 messages to people who are afraid or not afraid of diabetes, what these 2 messages will be?
My first message, I think, was very clear throughout the interview.
Sure.
And that was diet and exercise.
Okay.
We have to maintain a good lifestyle to prevent diabetes. And not only prevent diabetes, I think if you eat a good diet and you exercise, you'll prevent blood pressure problems, heart problems, cholesterol problems. Your joints will be healthier. You'll feel better. People feel less depressed, more upbeat. So that is the first message, diet and exercise.
Yeah.
And the second message is, whether you have a strong family history or not, get checked out for diabetes on a regular basis at every yearly physical.
What is the first time that you must get checked for the diabetes?
I think after the age of 35. And if you have a strong family history, if you have parents with diabetes or an uncle or an aunt with diabetes, I think it's never too early, because the test is very inexpensive.
Sure.
It's just a blood sugar test. We get so many tests done and we spend money on so many things. And a blood sugar test costs a few dollars.
Sure.
That's all it does.
Sure.
And if the blood sugar is normal, you can be reassured. If it's abnormal, you can do a further confirmatory test in the form of a hemoglobin A1C, which costs about $15 to $20 to do. It's not an expensive test.
So, Dr. Malkani, one more thing I want to ask you, that you have been practicing medicine for quite some time. Have you come across any really funny, crazy story about diabetes?
Yeah, actually, it's very interesting. Almost every other day, I see a lot of people every day. I see about 20 people each day. And ever so often I come across interesting anecdotes.
Okay. Let's hear one.
So recently I had this patient who knows everything about the complications that diabetes can cause and is very particular about taking care of the diabetes. And came to me and said, I think I'm getting a complication. I'm very worried. I have been delaying this visit because I'm very worried about something I can't see. And I think I'm going blind from the diabetes. And so I think I didn't want to come to you because I know nothing can be done. I'm losing my vision. So normally what diabetes does is it causes bleeding in the retina. And that can cause loss of vision, which can be irreversible.
Yeah.
So I took a look at this gentleman's eye and I found that all he had was a dense cataract.
Okay.
And diabetes can also cause cataracts. And cataracts are very treatable. So I told him, your vision will be back to 2020. You'll be fine. And we just sent him to an eye doctor. And he had a cataract operation and he was so happy. Everything was fine.
So you do this type of crazy patients too?
It's not crazy. People worry a lot about their health.
I'm saying that,
And I had another patient who had gone on vacation to Aruba. And generally this patient comes regularly for the visit only once a year, and the diabetes is very well controlled, so I don't see him more than once a year. But he called me from Aruba. He said, I'm canceling my vacation and coming back. I said, what happened? He said, my sugars are all in the 300s. And I'm hardly eating anything. I'm on vacation, but I'm very careful. I don't know why my sugar's in the 300s all the time. I'm very afraid. I have to come back. I said, you enjoy your vacation. Don't worry about it. No, I want to come and see you tomorrow. So he came back and he came with his log of his blood sugars, and everything was 300 plus. And he uses a glucometer, which everybody uses to test the blood sugar. And we did a blood sugar when he came to see me in my office, and his blood sugar was close to 100. And so what happened is that his test strips got exposed to high humidity. And when your test strip gets exposed to high humidity, the results are completely inaccurate.
Okay.
And that was the only problem. His sugar was actually fine. He was getting worried about.
So what is the number, like, you said 300, he was very alarmed.
Yeah.
What is the number it should go, then people should think, oh my God, I should really need
We like to keep the fasting sugar, that is before you eat, or a pre-meal sugar, between 80 and 120.
Okay.
And
what about if somebody has diabetes? For them also it has to be under 20?
Oh yeah, this is for people with diabetes.
Okay.
We like to keep the blood sugar before a meal between 80 and 120. And 2 hours after eating, we want to keep it less than 150.
Okay.
And in no case greater than 180. You know.
Okay.
So if it starts crossing 200, then it's not good. That's what we tell people.
And that's what you should do. Like, say it crosses 200, then what you should do?
If it starts going over 200, I think you should call your doctor and see what the next steps are. You may need to increase some of your medications or adjust some of your medications.
Okay.
You can also get low sugar sometimes, you know. Low sugars can cause a big problem too. There was this lady I treat, and this is another interesting story. She likes to control her diabetes very tightly. And when your sugar drops too much, you don't think clearly and you don't talk clearly. It's like having too much alcohol. You get completely disinhibited. And so she happened to have a low sugar in her son's wedding. And so in the son's wedding, she said a lot of embarrassing things because she had a low sugar, and no one realized she was having a low sugar. They thought she was trying to be funny.
This is really great. This is I could never imagine that somebody can talk like that. Does it happen like that?
Oh yes, you get completely disinhibited sometimes. And everybody, you know what they say about alcohol is when you have too much alcohol, your intrinsic personality comes through. So people who have intrinsic ideas of violence, they tend to get very violent. People who are very calm, they just get very laid back. When you have a low sugar, when it's very low, of course, you go into a coma. But when it's slightly low,
like what? Like what is the?
A very low sugar is anything below 40. You know,
Okay.
so below 40, you could go into stupor. You can be disoriented. A normal blood sugar is over 70. So, but when it is between 40 and 70, say it is 50 or 60, you could be very oriented, but behave strangely. You know what they say, you could be goofy, behaving, cracking strange jokes, or you're doing strange things. And at that time, people do all kinds of funny things.
Yeah.
Sometimes actually the cops pull people over when they're having a low sugar, and they think they're drunk.
Okay.
Until the person, they see some insulin or some meter lying in the car seat, and they realize that the person has diabetes.
No. Dr. Malkani, thank you very much, and we are really looking forward to listening you at the Health Expo.
Thank you.
And I think
having
Dr.
me
Om
here.
Ganda also will join us at the Expo, and it will be really going to be very educative for us and for our viewers and readers and audience.
Absolutely. I
And-
look forward to the Health Expo, and I look forward to being there.
Excellent.